Hello, welcome everybody. Thank you for joining us on part 2 of our Facebook Live, where Dr. Chavkin, Diana Chavkin from HRC Fertility, and Brittany Hawkins, who is a co-author with Catherine Handy of Everything Egg Freezing, a book which I love being involved in. They wrote a great book on what to do to optimize your egg freezing cycle, and they have a lot of great tips in here. And so we started our series a week ago where we were talking about what to do while you wait. So a lot of people are on hold for their egg freezing cycles and fertility treatment. And so while they're on hold, I thought it would be nice to bring Brittany, where we have conversations once a week up until we're essentially done with our COVID break, where we can talk about things that you could do while you're waiting for your cycles to start up again. So Brittany, I welcome you. Thank you for coming again for part 2 of egg freezing in the time of COVID, what to do while you wait. Let me just say that we are going to do part 3. We're going to do a segment once a week, like I said, and so next week will be our next segment, so please stay tuned for that. In any case, just wanted to give everyone an update as to kind of where we are at. As I mentioned last week, we are holding off on starting new cycles. So there are a lot of people who were interested in starting cycles about 2 weeks ago, and we, according with ASRM guidelines, made a decision to not start and not to initiate new cycles. We had kind of finished up our cycles that were in the middle of treatment, but decided not to start new cycles just because we want essentially people to be away from other people. So in order to maintain social distancing, we have to keep people out of the offices and out of commutes and at home. And so for that reason, we're doing that. And also, we want to be able to have resources available in the medical system available should people need it in the middle of an egg freezing or an early pregnancy and all that. So we want to initiate cycles again, hopefully once we have leveled off the curve or kind of on the downslope. But we believe at this point, at least, that we might still be on the upslope of new cases of COVID. And that's why, at least at this point, we're just holding off on initiating new cycles. However, I still am doing initial consultations, follow-up phone calls, remotely, so by phone and by Skype, just to keep people ready to go so that once we are able to open up our doors and initiate cycles, we can do so immediately. But again, the reason why I have Brittany here is because we are going to talk about some of the things that you may want to think about doing while you are waiting for your cycles to start. So with all that huge introduction, again, thank you, Brittany, for joining me here today.
Thanks for having me. Yeah, as Dr. Chavkin, you know, you helped us quite a bit with the book, and a big portion of writing this book was all about what you can do in the months preceding your treatment in order to optimize your egg quality. So basically, there are a few months while your eggs are maturing and chromosomal processing is occurring, where the decisions you make in your lifestyle can actually make quite a big, or can make an impact on the egg quality. So basically what we can do in this time period while we're waiting for treatment is to kind of adopt some positive lifestyle behaviors that might actually, you know, give us back some control in this very bizarre and kind of interesting time. So I've actually just thought about 4 things that are pretty tuned into what you might be considering around this exact time, whether that's the food you're stocking up on, or, you know, is your mental health, as well as what's in your personal care or what's in your sort of personal care routine. So what I'm going to talk about today is specifically around those personal care items. What you may not know is that in the US, there are about 200 different, what we call endocrine disrupting chemicals. These are basically a fancy way of talking about your hormones. And as you know, when you talk about disrupting your hormones, it can actually have an impact on your body's sort of the signals your body tells to your ovaries in which to mature eggs and bring them to the next level of maturation. I know you've done some research on this yourself. I don't know if you want to chime in on some of those sort of endocrine disruption that happens.
Sure. There are, I recently, about maybe a year ago or so, I published a review article on the different exposures in our environment that could affect our fertility. And yes, many of them are endocrine disruptors. A lot of things found in, unfortunately, things that we use every day, plastics, containers, other things in our environment, pollution can affect our hormonal system and the signaling and the mechanisms that take place in our bodies that can definitely affect sperm count, ovarian reserve, egg supply, quantity and quality. And so it's important to think about things. I mean, when people come to me and ask me about them, I mean, I obviously have an interest in this, and I think it's important to think about. And I think as a society, it's important for our society to understand these issues so that we could make some changes for the better. But I will say that when patients come to see me, it is a little bit tricky, and that's why I'm interested to hear kind of what your, practical advice is, because for a lot of people, I try not to get them too worried about all of the things in the environment, because it really is it's impossible to be to avoid these things because they're kind of all over. Right. And so I worry that when people start worrying about that, they kind of maybe get sidetracked from maybe some of, I don't know, the kind of the overall picture. And so I do think it's important. And that's why I wrote that review article. And I think, unfortunately, though, a lot of this has to be in the hands of industry to be a bit more responsible. But it does start with people being cognizant so that we can push industry. And yeah, but with that, I'd like to hear what are some like specific things people can do, because, just like from my part, I try not to get people too nervous about the specifics.
Yeah, no, I think you make a good point, and it's important to say that this is, what we're going to talk about is basically just, it's not going to make or break the future of your egg freezing procedure. This is not the difference between the treatment working and not. But if you have this time and you have this opportunity, it's going to be great for your ovaries, and it's going to be great for your health. So also in preparation for what is a long weekend with Easter, and for many of us, we will not be going home to see our parents. Why not take a little time and do a little bit of a personal care cleanse? So as you mentioned, this is actually extremely, shockingly difficult to do, partly because literally these chemicals are everywhere. They are not well tested, specifically in the long run, and even more particularly on women. So with that, it's also difficult. There's not a lot of labeling procedures, but basically what you should know is that there are about 200 of these different endocrine disrupting chemicals just in our personal care products and makeup. To put that in perspective, the EU has banned over 1,400, and the US has only banned 30. So, it's just a little bit of a context for you as to, this is going to be great for you overall. Mm-hmm. So it can be a little bit overwhelming. The place I recommend starting is sort of like a 4-step process. First of all, just pour out all of your personal care items, your makeup, everything, just pour it onto the ground. I don't know if you're like me, you get attached to, you may have paid for it, so you don't want to get rid of it. So you just kind of leave it there in a drawer that you don't really look at. So this is your chance to just
to say also, I mean, I think a lot of people at home now are kind of cleaning out their closets, right? You're kind of at home, and so you start noticing, wow, this closet has been, all messed up for all this time. Let me take it all out and clean it all. So as you're a lot of people are doing that now. And so as you're cleaning out your closet, maybe pay an extra attention to what the things are, what the ingredients are in these things that you're deciding to put back into your shelf, right? And maybe exactly ingredients you may say, you know what, maybe this thing that's half empty, maybe I don't need it because it has this and this in it.
Totally. So I think that the first step is just dump it all out on the ground. This is a very Marie Kondo approach. So you start organizing them in different categories, whether it's lipstick or lotions or whatnot, and then actually just take the first step and start to look at expiration dates. They sneak up on you. Everything has an expiration date. We actually, on our website and I should also mention inside of our new Fertility Fit app, which is free, especially during the COVID-19 pandemic, we have everything you'll need to know in there, along with a list of the expiration dates on all the personal care and makeup items. So that should just be your first step, and that'll just help you narrow down your, sort of toxin detective work, which then becomes step 2. So now the next phase, you really want to suss out where the biggest toxins lie. It's very hard to do. I'm not going to sugarcoat it. A sort of secret word for chemicals is the word fragrance. So anytime you look at a product and it has the word fragrance in it, chances are it is chock full of a variety of chemicals, many of which are endocrine disruptors. And so that word in general, you just want to try to avoid. And then the 2 other detractors are something called phthalates and parabens. Phthalates also found in plastics, and parabens, which are typically, kind of used to help prolong the expiration dates of products.
And that was a big category of what we talked about in our review article that I'd mentioned, the phthalates and the parabens. So I'm glad that you mentioned it as well.
Yeah, it's the problem is that there are so many different names for these different things, and you might look at the label and just get really overwhelmed. We do, inside the app, have a list of different resources, whether that's the environmental working group. We've got a list of products that we've kind of deemed approved and clean, and there are other brands that kind of have done a little bit of the legwork. But generally speaking, use fragrance as your main word. And then if you see anything, like one other little trick you can use is if you see the word paraben at the end, so it'll be like methyl paraben, whatever it is, like then you also know that's sort of a proxy for any type of paraben. Phthalates, on the other hand, nearly impossible. But like I said, just kind of go through and look at some of the main ones that you use the most, and figure out which ones kind of are the biggest toxin detractors. And then
one thing I'll just say about that I've sort of learned with my children, I get baby shampoo, special natural baby shampoo, and it says on it no parabens, no phthalates. So if you're not attached to a certain type of shampoo or conditioner, you may just want to think about going to the children's aisle for your shampoo and conditioner in the health food store, right? So in Whole Foods, they have a special children's area, and so that might be something to consider, because I think they're maybe a little more careful with children's products.
Yeah, especially at Whole Foods, I think they have a lot more discernment when it comes to their products. So the other thing with that, when it comes to kind of figuring out which products you want to maybe start to replace with cleaner ones, is to consider there's a few things such as higher, like based on how they are absorbed in your body. So some factors there are higher skin temperatures. So if you're in the shower, things like shower gel, you're more likely to absorb it. Exposure length, so that's things like lotions. You can imagine you've got a large surface area, and if it's covered, also the integrity of the skin. So if you have acne or broken skin anywhere, that is actually more likely to absorb those toxins.
And so now,
and then the fourth one is
now when everybody's washing their hands so much. I mean,
yes.
we know that we wash our hands all the time, and our hands are always dry, and so that's, but now everybody's washing their hands all the time, or putting, hand sanitizer on their hands, which has a lot of drying alcohol on it. And so you may be using a lot more moisturizer than you usually do. And so maybe, because of that, look at what's in your moisturizer and something that you want on your hands, and potentially then touching your food and touching your mouth. And again, with cracked, dry skin, more is likely to seep into those cracks.
Yeah, and that goes back to fragrance as well. Anytime it smells like a potpourri bowl, it's probably not going to be great for you. So it's sort of learning a new behavior in that sense. Another one I think is actually pretty interesting is that the area of skin exposed really matters. So for example, your scalp and forehead is up to 4 times more absorbent than your forearm, like the skin on your forearm. And also your armpits are really absorbent. So for that, I would also recommend not using an antiperspirant, which uses some other chemicals that are actually blocking your ability to actually sort of eliminate toxins. and I would go for a clean deodorant. Again, there's recommendations for this in the blog and the app. So the fourth step is really just trying to figure out, now you've found those biggest attractors, and that's not just based on the amount of chemicals in that product, but also the way in which your body absorbs them. So now the fourth step is really just trying out some new replaceables. Obviously, now is not the time you want to be shopping in all kinds of retail stores, but what's really exciting, and hopefully we can kind of help perpetuate this change, which is that big box stores like Target and even Sephora are offering more clean ranges. That's simply based on demand. So you can find alternatives there, and obviously everyone is shipping to your homes these days, and so taking some time, looking at reviews. Again, we have some listings for products that we've tried and recommended, but really it's just kind of finding those few and realizing which ones you want to prioritize, and then spending a little time to figure out what your new go-to is going to be that's going to be a lot better for your fertility. So yeah, it's a little bit of a process, which is why it's good that you have that long weekend. But I think just being a little bit more cognizant about these things and understanding how they're really affecting your body, and the fact that really there is no strong regulation around this, it's something that I was personally really shocked by, not just from what it can actually do to our bodies, but also because there's little to no regulation. So many of these chemicals are actually just put into everything, like our food system and our products, without being tested.
That's no, exactly. And that was my point for why I said, writing that review article and kind of making people aware, so that maybe, they reach out to their, representative in government, or they write letters or petitions, or, I think that it has to kind of start from us to kind of push our government to say, we need more regulations. This is absurd how it's just kind of a free-for-all out there with what companies want to put into these products, and it needs to be regulated a little bit more. And so I think we just have to raise the awareness and have people care about it, and so that it can be more regulated.
Yeah, and as you touched on earlier, this affects men as well in a big way, potentially even more than women. So there's conjecture as to whether or not the decline in sperm counts is due to endocrine disrupting chemicals. There's just a lot of factors that are actually really hurting all of us. So if you live with a partner or a male roommate or whatever, this is definitely something you should probably try for the whole house.
Yes. And there's definitely lots of evidence for that. And so again, I just wanted to, I thank you for, bringing that to our attention, and also for, mentioning the app, and thank you for offering that for my patients. I think it's a great resource. Again, just to emphasize, a lot of us are home. We're all should be home, right? Unless we're running out to the grocery store or in the health industry. So when you're home and you're cleaning out your closets and you're thinking about your next steps for fertility, and you want to optimize things, yes, think about the chemicals in your products, in your shampoos and your conditioners and your moisturizers as much as possible. Get rid of the stuff that has the phthalates and the parabens. Think about replacements. Like I said, I love the natural children's products, but for adults. But it sounds like Brittany and Catherine have put a lot of nice information on their fertility app, where you can look at resources there. But I just want to kind of emphasize, this is for while you have to wait, right? I would not really say, okay, now have this information, and I don't want, let's say we open up our doors in a month to start treatment. I don't want my patients to think, okay, now I have to wait another 3 months of being on the good shampoo or conditioner, right? Because a lot of time is of the essence. And so, yes, we're waiting this out, and we're waiting for COVID, and we want to make the most use of our time. And so it's at this point in time where we want to think about what we can do to optimize things once we can start. But then once we can start, it's sort of important to also think about the time to be things.
Yeah, you're absolutely right. I think, just reiterating that again, age is the number one factor when it comes to fertility. So the second that you have the opportunity, it's going to benefit you, but also just kind of raising awareness while you have this time, and it's going to benefit your long-term fertility regardless,
and your
health and fertility.
And your health.
Yeah.
Right. There's
exactly
others that are affected by these chemicals as well. So yeah, thank you for bringing that to our attention. And I'm hoping next week, same time, same day, we can have this discussion where you bring another point up to our attention where we could think about what we can do while we're home and waiting to start our egg freezing or other fertility treatments. So yeah, I love having you here. Thank you for doing this with us. I, again, wanted to just reiterate that right now we are still on hold initiating fertility treatments, but that's because we believe that we are kind of a little bit still on the upswing in terms of new COVID cases and a strain on our health system. But once that levels off or we're on the downslope, we're going to think about starting cycles again, and it's going to depend on the situation and the patient, but I'm continuously giving updates on my social media, on Instagram and Facebook. If you ever have a question, please feel free to call my office in West LA. Happy to talk to you to give you an idea of what the status is for where we are at. I do want to emphasize, when ASRM came out with the recommendations, a lot of people said, well, fertility treatment is not elective, right? If we want to have a child, we're going to need fertility treatment. How could that be elective, right? And I don't think ASRM, and I'm definitely not saying that fertility treatment is elective. It isn't. It's not elective. Infertility is a true disease that needs to be treated in a medical way. However, there really should be no difference as to whether we start your treatment now or in a few weeks or in a month or 2 months. That's really not going to have a big impact. And that's why, because of what's going on with coronavirus and the strain on our health resources, we believe that the safest thing to do is just wait for us to get over the hump a little bit and then reinitiate cycles and give people the necessary treatment that they need. But again, let me hone in on a subtle point here, right? So if this were our new normal, and which is not, right? It definitely is not. We are going to get through this corona crisis. But if this was our new normal, we would figure out a way to do fertility treatments despite this. But because we know that this is something we're going to overcome and get through, we want to just wait till we're in that better place before we initiate the treatments. So again, we will continue to give you updates and continue to give you some good tips and things to think about while you are home. And so Brittany, just give us maybe just a little soundbite for what we're going to talk about next week, what you're going to bring to our attention.
Yeah, so next week we're going to talk about food and stocking up on sort of so stocking up on, being practical in this time when you're obviously trying to kind of maybe prepare your pantry for about a week. So kind of some considerations on how to just be more cognizant when selecting what foods to add to your pantry. Great. Also, just quickly, Dr. Chavkin, speaking of the elective, word elective. Right. Should we reveal that we were talking the other day about how there's this term called elective oocyte preservation, which I think it sounds like it's a party that you go to. It's not really like.
Well, elective sounds like it's something you can do, but you don't really need to do. Yeah. Right. And it's, I think, to differentiate between the medical egg freezing. So usually, we think about egg freezing if somebody has a cancer diagnosis and they are going to be undergoing chemotherapy or some gonadotoxic therapy that can be damaging to their ovaries or to their eggs, then we say, okay, freeze your eggs beforehand, and that's considered medical. Everybody else who's just scared of getting older and scared that their fertility is going to decline with age, and those people who are freezing their eggs are considered either elective or social egg freezing, right? So we were saying, well, social egg freezing, first of all, elective is terrible because it's not.
Oh yeah, social egg freezing.
Right. Social egg freezing also sounds like a party, right? And
so
we came up with a new term yesterday.
Yeah. So our new word is, ready? You say infertility prevention treatment.
Right. So infertility prevention.
So basically the idea is that, Go ahead.
Well, the idea is that you freeze your eggs now, and so in the hopes that one day, if you were to face infertility, that infertility situation is prevented because you have frozen your eggs earlier. Some people would argue, well, prevention is not a great word because it implies a guarantee. But really, that's not the case, right? Like if you were to get a vaccine for the measles, that's preventive treatment, but does that 100% guarantee that you're not going to get the measles later on? No. Or pap smears, right? Pap smears are to prevent cervical cancer. Is it a guarantee that you're not going to get cervical cancer just because you get pap smears? No, not at all. So it's the same thing. This infertility prevention treatment is egg freezing. It's not going to, well, first of all, it's not going to 100% prevent infertility, right? You may face infertility, but the idea is that you are increasing your chance of having a child one day by doing the preventative measures now of freezing your eggs when you're earlier. So we were just talking about how, there really was not a good word for this social egg freezing or elective egg freezing. So we wanted to kind of give it a more legitimate term, which we thought was infertility prevention treatment.
Exactly. So next week, we'll discuss more about what you can do in preparation for your infertility prevention treatment.
Great. All right. Well, thank you.
On that note, we'll see you then.
Yes, sounds good. Thank you, everybody, for joining, and hang in there. Talk to you soon.